Today, 28th of July, has been set by the World Health Organization as the World Hepatitis Day. The theme of this day today is I Can't Wait. This theme has been set to accelerate effort to eliminate hepatitis. So, what is hepatitis? Hepatitis is any injury or inflammation to the liver cells. There are many causes of injury to the liver cells, and the commonest ones are viral infections. Then alcohol is also another major cause of hepatitis injury, and also we can have chemicals like aflatoxins. So viral infections to the liver are caused by various groups of viruses. The first one is hepatitis A virus, which causes acute infection of the liver, and this is a single-stranded RNA virus transmitted through the fecal-oral route. So it's usually contamination of food with the fecal matter or water. So the best way to deal with this is with hygiene. Then we have hepatitis B. Hepatitis B is caused by a double-stranded DNA virus, which causes acute or chronic infection of the liver. Acute means injury to the liver cells, which has been going on for a period of about 6 months. When the process continues beyond the 6 months, then it becomes a chronic infection. The main routes of transmission of hepatitis B is through blood or blood products. So transfusion with contaminated blood, through sexual contact with people who have hepatitis, and you also can have prenatal transmission of the virus from mother to the baby. You can also have other routes of contamination from people who have the infection through body fluids like saliva, and this can cause infection to individuals who do not have the virus. The other virus that also causes acute injury to the liver cells is hepatitis C virus. Hepatitis C causes also acute infection, also transmitted through blood or blood product, and also sexual contact, or also prenatal transmission to unborn babies. Then we have hepatitis B, which is usually co-transmitted with hepatitis B. Hepatitis D cannot be transmitted to an individual on its own. It gets transmitted together with hepatitis B. The individual can get the two viruses transmitted at the same point, or you have hepatitis B and then you have subsequent infection with hepatitis D. Then we have hepatitis E. Hepatitis E also usually causes acute infection, and it is also transmitted through the fecal-oral route. So what are the symptoms of hepatitis infection? Usually the individual might be symptomatic or asymptomatic. Initially you have the acute symptoms, which present with flu-like symptoms. You have general body weakness, you have fever, you may have vomiting, you may have nausea, you may have abdominal discomfort, especially from the injury to the liver cells, and then subsequently, after the continuous injury to the liver cells, then you have development of yellowness, which can be manifested through the eyes as yellowness of the eyes. Also, you can have yellowness of the below the tongue. You can detect it below the tongue. Also, the palms of the hands and also the feet. The individuals also may have a darkening of the urine color. You may also have paleness of the stool, and with chronic infections, you have presentation with symptoms of liver failure, which can present with abdominal distension. You can have the yellowness of the eyes, and then you can also have development or subsequent development of hepatocellular carcinoma, which is a cancer of the liver. So how do we treat hepatitis infection? The easiest way to deal with the hepatitis is through vaccinations. Individuals who have not been vaccinated, especially healthcare providers, they need to get the hepatitis B vaccine, and this will help them from not getting the virus. You also have people who have exposure to the virus from their spouses, and they are not hepatitis B positive. They also need to get the hepatitis vaccine, and the hepatitis vaccine is available in most of the health care facilities in our country. The hepatitis vaccine is also available through the expanded program of immunization, and this is given to babies. You have babies who have been born to mothers who have hepatitis. They need to get hepatitis immunoglobulin, and this is where we need concerted effort to avail the immunoglobulin. And they also need at birth hepatitis B virus vaccination. Then they can follow the normal KP expanded program schedule of hepatitis vaccination. So the good news to the Kenyans is that from the year 2000, the government of Kenya has made hepatitis vaccine as part of the expanded program of immunization. So those individuals who have been born at that period, they have been immunized against hepatitis virus. But those who have added risk, they need booster vaccination, especially health workers and the people who have partners who have been exposed to hepatitis infection. The other way of getting to know your hepatitis B status is getting tested. So we highly encourage individuals to get screened for hepatitis infection, so that if you have the infection, then appropriate treatment can be started. There is no complete cure to the virus, but the virus can be suppressed to levels that it does not lead to the chronic complication of hepatitis, especially cirrhosis and the hepatocellular carcinoma, which is cancer of the liver. So I call upon Kenyans that we all come forward and get tested for hepatitis B and get the care, and we also ensure that children who are within the age of vaccination get the opportunity to be vaccinated for hepatitis B, so that we cannot be able to eliminate hepatitis B infection. And then also consistent hygienic measures to prevent infection with hepatitis A, hepatitis E, which are majorly transmitted through fecal-oral contamination. Thank you.